My family consists of me and my husband, Eric. We have 3 beautiful daughters, Chloe, who is 13, Emery, who is 5, and Brinley is our youngest, who is 1.
We have been married almost 5 years now. We are from Wichita Falls, Texas.
Brinley has a complex form of congenital heart disease. Normally the heart has 4 chambers and 4 valves, and the inlet valve on the right side of her heart did not form correctly, so that's tricuspid atresia. And then commonly associated with that is transposition of the great arteries, where the 2 main arteries that leave the heart didn't attach themselves appropriately to the ventricles. And along with that, then her aortic arch was very small.
We found out about her diagnosis at my 20-week sonogram. I will just never forget his words, just saying that there is something wrong with her heart. And we finally got in here to see Dr. Broughton a week later, and we chose here just because we hear remarkable things about this place. And we discussed procedures that she would need following her birth, and that we would have to be here in order to deliver her because we just didn't know. And being so far away, I didn't function the last 3 months of my pregnancy because you just don't know if you're going to bring your baby home. It was just that moment after she was born that they tell you, we're going to give you a couple minutes with her, and she looks perfect. And I just remember coming over here to Cook's and seeing her, and I remember going back to my room, and the next morning the phone ringing at about 8 o'clock in the morning, and it was Dr. Tim telling me that Brinley would be going into surgery.
She had to have an operation to reconstruct the main vessel, taking the blood to her body, and then provide her with blood flow to the lungs by means of a Blalock-Taussig shunt. Early on, they're monitored fairly closely. We have a home monitoring program.
In the home monitoring program, you monitor everything, you know, her food intake, weight every day. You know, at the time you're just like, man, this is a lot, but you know, looking back, I'm like, that is the reason I knew something was wrong.
Changes can occur pretty quick, you know, even though we see them monthly, or even sometimes every 2 weeks, things can change very quickly in that patient population. Their surgery, while a good one, is still very tenuous.
She would wake up a little bit and smile and be her playful, happy self, but it was little amounts of time, and then she would go back to sleep. And I called, and her pulse ox, I think, was finally in the 50s, and they were like, bring her immediately. And we came straight here, and the next day she was in surgery again.
Her second surgery is called a bidirectional Glenn shunt, where the blood flow from the head and the arms is redirected directly into the lungs.
Brinley also did very well with that procedure. It's actually currently where Brinley is still. For right now, other than obviously the difficult time she had with her surgery, she lives a very normal childhood. She's active, she's energetic, she harasses her sisters, she cries, she fights, she wants snacks, just like any other child her age.
I don't think she's aware that there's anything wrong with her, other than her getting tired sometimes.
She has 2 older sisters that she gives them a run for their money. She's my miracle.
As they get older and hopefully do well, the follow-up is less intense, such that by the time they're going to kindergarten, they may be seen in the clinic once a year. And I would hope that you wouldn't be able to pick them out from any other child in the classroom.
She'll go to school, she can participate in certain athletics. The majority of our kids have a pretty normal childhood.
She definitely will be having a 3rd surgery.
Final stage is something we call a Fontan procedure, and since Brinley's not quite there yet, while she's doing great, we're still waiting for that step. You can see in Brinley she's got a little bit of purple color to her lips because her sets aren't 100% yet, but after the Fontan she'll be just as pink as you and I.
There was so many times where we were uncertain on how things were going to turn out, or the outcomes of even certain days, and we had a little bit better of an understanding from the American Heart Association's website. They explained everything. They've helped to contribute to everything that she's been able to accomplish up to now.
The American Heart Association helps us to accomplish our goals by providing vital research in the area of pediatric cardiology to help us find what the best practice methods are and what is the best way to manage our patients.
The people that come before you, you know, that have traveled this road before and have made it possible to be where we are today, you know, is just something you're very thankful for.
I think it's just made us all more loving and appreciative of the life that we have, and knowing that, you know, there's nothing to be taken for granted, nothing's guaranteed.
Just seeing Brinley go from this little sick baby who needed surgery so soon to this little bubbly, charismatic, demanding, you know, typical little toddler, and seeing the family's joy that they get from her life. That's definitely what Brinley means to me. She's a great little girl.